everybody. This looks a little too dark in here, so hello everyone. Let me fix something over here. Let's see. Get some light. And God said, "Let there be light." Hi everyone. Welcome to Hospice Nurse Julie's live at 5. That's my alarm telling me I need to go live. As you can tell, it's serious business around here. Welcome, everyone. Come on in. I don't think I need this little light. Maybe I do. Hi, Jeff. I have not had a psychic present at someone's death. No. The family would have to organize that, not me. David says, "Hello, Julie. How are you? Are you a Los Angeles Sparks fan?" Is this awful that I don't know what a Los Angeles Sparks fan is? Oh my God. It's probably like a sporting team and I just don't know it. How bad is that? Astrid, I have not seen anyone die from systematic lupus. Welcome, everybody. Come on in. I'm Hospice Nurse Julie. In case you don't know, I go live at 5 every Thursday, Pacific Standard Time. This community is really great. Please talk amongst yourself in the chat as long as everyone is respectful. Karen is hiding the cat. Oh my God, Karen. Yes. If you guys haven't seen on my Instagram, my sister and I hide this bird back and forth on each other. It's her turn to find the bird. And now on Instagram, we are trying to decide the name of the bird. Oh, it is a WNBA. That's cool, David. I've never even been to an actual NBA game. Mr. Poggy, nice to see you. Oh no, Mary M says, "Watching the live just broke my shoulder in 2 places. Some pain. Shoot." Julie teacher, Julie Macauica. I'm way off, I'm sure. I don't know how to pronounce anything. Says, "Does anyone know a good grief book I can buy? There are probably many. Do I have any off the top of my head? No, because I'm awful at remembering titles. But It's Okay You're Not Okay is the one that comes up to mind. But everyone, if you could tell her in the chat what a good grief book is." Welcome, everybody. Come on in. Hey, Annie. She says she finally caught me live. How do you handle or stay away from burnout? I don't work full time. Even before this whole Hospice Nurse Julie thing came about, I did not work full time. I worked per diem and basically lived under my means. So I didn't have to work full time because I think being a nurse full time is pretty hard. Other than that, if you have to work full time, I would work for a unionized company. If you can't do that because you're in a state that's not really unionized, got to work on boundaries, call out when you need to, use your sick days, don't work overtime, say no. It's a big myth, I think, that we all I don't like that we're all subscribing to this idea that we have to work X amount of hours a week and work. I just think we're getting it wrong. We are getting it wrong as a society. Welcome, everyone. Come on in. If you see me looking this way, because I'm looking at the chat. Hello to everyone just joining us. Welcome. Live at 5 on YouTube. Hey, Petey Boy and Kramer. Hey, Pam. I am not married and I do not have a family. No. I have a family like a mother and a father and a brother and a sister, and I'm the baby. So that can make it a little easier for me as far as how I work. But I would strongly suggest, even if it feels like you can't do it, as far as working per diem or cutting back on time, I would really strongly suggest that you still try to look into it. If it doesn't work, you can always go back to being full time somewhere. You're a nurse. Any nurse who is feeling burnt out or unhappy in what they're doing, I really strongly suggest you try to make some changes in your nursing career, because nursing is a great career to be able to move around and change your life and change what you're doing all the time. Um, okay, let's see. I took your advice and got hospice help. I wish I could have gotten you. You were a huge help. Oh, Jim, thank you. Thank you, thank you, thank you. Julie, do you have to become a certified hospice nurse? If so, what course would you recommend? You do not have to be a certified hospice nurse to be a hospice nurse. You just need to be a nurse. You have to be a nurse to be able to be a hospice nurse. Um, as a CNA, which is a certified nursing assistant, they always guilt trip us into working overtime. Vicky, you gotta be strong, baby. Don't do it. And I got to tell you, at first, when you hold your boundaries, you're not going to be the most popular person that you work with. People are not going to be happy about it. They're going to say things like, if you don't do it, so and so has to do it. Thanks to you, I had to work overtime because you said no, but I couldn't say no. And I hate to sound callous, but honestly, you have to start believing that what you need matters. What you need matters. If you cannot do it, you cannot do it. Doesn't matter if you're the only one who can do it. That's their problem. And it's not like, but then the patient suffers. I do realize that, but that's the whole point of healthcare. They use and abuse people who work in it, and it is not fair. At the end of the day, you matter. And if you can't do the overtime, you can't do it. And guess what? Once you start doing that and people start seeing that you're really holding strong and doing it, other people you work with will start doing it too. Then eventually it changes the culture of where you work. I've seen it happen with my own eyes. I've seen it happen with my own eyes. Can you address how to assist a family when someone doesn't want to be in the room with a dying relative and their siblings shame them for their absence? Oof. I would have the family be working with the social worker prior to this going on, because a social worker needs to have a family meeting to talk about what's going on. I mean, a family who is doing that likely doesn't have a super healthy relationship with each other already. If they're already shaming each other and blaming each other and doing a bunch of things, all families have issues, right? But all of those issues are going to be amplified at the end of someone's life. People don't just start dying and then everyone thinks like everyone gets like happy go lucky and like it's kumbaya at the house. It usually gets worse because the stress is high, right? So, normalize that this is happening. I would get social work involved so they could have family meetings. As a nurse, it's not totally the nurse's responsibility to handle this. However, if the nurse is there, they usually probably will try to talk to the family about like what's going on. Generally speaking, I would try to nip this in the bud before the person's dying, and normalize the fact that like dysfunction is happening in every family, and just because someone dying doesn't mean people are going to suddenly have a healthy dynamic have a healthy dynamic. And they can shame someone all they want, but it's not shameful to not want to be in the room if you don't feel comfortable, you know if you don't feel comfortable. Although I would stress that, like, how about we all educate ourselves to get down to the bottom of why you don't feel comfortable? What about it is scaring you? How can we help you? Right. So that's a really long winded answer and it's kind of all over the place, but hopefully it helped a little bit. Hey, Julie, how are you doing? Quick question. When do patients stop talking near the end of life? I've always wondered. Everyone's different, but usually once they start getting into the transitional phase, which is like almost the very last phase. The last phase is called the actively dying phase. That's usually when most people stop talking, um, or a little bit before that. Now, if someone has a disease like Alzheimer's dementia, they will have stopped, or ALS or something, they will have stopped talking, or stroke or Parkinson's disease. They may stop talking long before they are dying, just because that's part of the disease. Okay, welcome everybody. Come on, and I'm just going to look through the chat to see who I've missed so far. If I've missed your question, please just keep asking it in all caps. I will try to get to everyone's questions. Sorry, hold on. I see someone's calling me. Um, and if I know, I don't care if you guys keep asking questions over and over, right? But if I've already answered like one or two of your questions, I probably will not continue to answer all of your questions. I'm going to try to get to other people's questions, if that makes sense. Darlene has a congestive heart failure. Can he get heart attack from this ejection fraction? 25%. It's a great question. I should know this. I mean, I don't necessarily know if ejection fraction can cause heart attack. I mean, I guess it puts a strain on the heart. 25% is pretty low ejection fraction. So it's pretty like end stage disease-ish. But Darlene, I would talk to a cardiologist about this. How long can modeling be present before death? So a lot of people would take modeling is very specific, is what I'll have to say. Modeling at the end of life, when you're actively dying, you have to be actively dying and then see the changes in skin color to be considered modeling. A lot of times people can have just circulation issues, so their like feet will be purple, and then people will say, "Oh my God, that's modeling." That's not modeling. Modeling is only when someone is actively dying. So you have to be actively dying, which is the last few days of your life, fully unconscious, changes in breathing, changes in skin color. So that could be modeling. So don't confuse modeling with, oh my God, you guys, why am I so like not out of it, but I've been really having a hard time finding my words with poor circulation. There you go. So modeling can be present a few days before death. I have a sty on this eye. It really hurts. It's like every blink hurts. What does the dying process look like for people with heart and lung disease? I'm 25 with pulmonary arterial hypertension. I just want to know what to expect about a year or so. So, Caitlin, I'm so glad you're here. Such a great question. I would say this generally speaking. Where's your question? I already missed it. Hold on. I'm going to answer this. I just really want to see where your question went. Here she is, Caitlin. Okay. So I'm so glad you're here. Great question. I will say, because you are young, right? And you have this, I would say, like chronic disease or like life limiting disease. I don't see many people like you. I do see some young people like this on hospice every once in a while, but everyone's end or like the end of life journey looks a little different depending on the severity of diseases and how like things turn, right? So it would be a little hard to know. And I'm not just saying that to like appease you, truly. If I saw a bunch of patients like you all the time and I could feel like I could tell you, I would. What I would say though is, because you're young and because you have this chronic disease, right? That probably already goes up and down, up and down. You plateau here, doop a doop a doop a doo. Then something happens, boom, you're in the hospital, you're super sick, everything seems wrong. You might stay in the hospital for a while, then slowly crawl up, and then you get out of the hospital. Then you kind of have to go to rehab and kind of like rebuild your strength. And next thing you know, you're kind of coasting along again. I feel like it'll do a lot of that. You'll do a lot of that. I would ask your pulmonologist and your cardiologist what they think. What does the typical lifespan look like? How am I going to know when it's end stage? And if they say stuff to you like, "Don't talk about that yet," you say, "Listen, I am trying to prepare myself so I can have the best life and the best end of life that I possibly can have. And I want to know what it typically looks like." And you can start making choices on your own about what you want, what you don't want, and versus what you don't want. And what my strongest suggestion would be is to fully plan out. And of course, things will change and this will change, but fully plan out what you would like your end of life to look like. Do you want to be home? Do you want pictures around? Do you want a lot of family around? Do you want music in the background? Do you want TV in the background? Do you want to be hospitalized? Do you want to be intubated? Do you not want to be intubated? So all the things. I would plan it all, and it might change over time, but that's what I would do. And I'm so glad you're here, and I'm so glad you're asking questions like that. Hey, Jacqueline, thank you so much for the $5. Is dying from respiratory like COPD painful in your experience? I have severe COPD. My greatest fear is suffering. So, Jacqueline, I see many people on hospice with COPD. However, I will say it's like very, 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 very end stage when I do see them. I wouldn't say it's painful. That's for sure not. But you will have to like get used to your new normal. And the new normal is just going to be a lot of what you probably already see with that like chronic life-limiting illness, which is, over time. At first it was just hard for you just needed oxygen at this time, like when you were walking upstairs or something, right? So you're going to see, and then now you need oxygen all the time. So now it's kind of hard to leave the house. And it was hard to walk down your stairs. Now it's hard to walk down like even 2 stairs. Maybe you can't walk downstairs. Maybe you can't walk upstairs. So you just start slowly declining functionally. And it's not painful, but that's hard for anyone to, you know, um, manage emotionally, spiritually, right? Your life is changing, or you're changing. So I wouldn't say it is painful physically, but it can be painful just because your life is changing, right? And the biggest thing, right, is it's hard to breathe. So there's many things we can do on hospice to help you not feel like you can't breathe. But a lot of those things will make you tired, right? You'll sleep a lot. You won't want to eat that much because it takes a lot of effort to eat. You might need a lot of morphine. You might need steroids. You might need albuterol treatments, like all these things to kind of keep you feeling okay, which is not necessarily fun, right? So that's the truth of it. But I wouldn't say it's painful, and we definitely can manage it. And again, I would always recommend planning for all of this. Plan, plan, plan. Everyone, even if whether you have a disease or not, we should all be planning our end of life and knowing what we want. How many dementia patients are talking before death? All of them. I am caring for my mother with dementia. No, I would say most patients with dementia are not talking before death. Most, but not all. Every once in a while, people people surprise me, right? I'm trying to go back to look at some of the questions. Bear with me, you guys. Thanks for joining. Thank you to everyone saying thank you. If you guys are if you guys didn't know, I have a book out, Nothing to Fear. It's a New York Times bestseller with a journal to go along with it if you're interested. Thanks, Heidi. She saw my Pessy talk today. Oh my gosh, how do I unwind? I do so many things. I love reading lately. I love watching TV. That's my biggest way to unwind. I go for a lot of walks. I am involved in a 12-step program for my alcoholism. I do that, 3, 4 days a week. I'm really involved in that community. That really helps me unwind. So thank you for that question. I like it. Thank you for everyone saying thank you. When a person begins the actively dying stage, is there a standard of time frame until death? Yes, it's usually, I would say, less than a week. Usually. How can you tell when someone is an end stage liver cancer? Hopefully, your doctor is telling you that. If a doctor has said there's no more we can do, I would say that's end stage. Does that mean they're going to die tomorrow? Absolutely not. But that just means there's no more treatment we can do treatment's not going to make this any better. If that's the case, then they're end stage-ish. Do they have 6 months, a year? Who knows? But that's the kind of stuff we need to talk about. That's the kind of stuff we need to ask our oncologist. If you're talking about a person, Bambi, love your name by the way, who has liver cancer, you need to start talking to your doctors. Hey, what's this going to look like? How am I going to know when it's end stage? And if they start saying to you, don't go there yet, don't talk about this yet, it's not time yet. They might not do that, but they might. If they do, say, listen, this is my life. I'm comfortable with talking about death. I'm trying to plan this. I want to know. You see this day in and day out, so you know when someone's getting closer to death. If they try to say some bull crap like you never know, say, right, I know you don't know. I know you're not God, but you see this day in and day out. What does it look like? What am I looking like? And if they can't do it, ugh, dare I say, get another doctor, but ask for palliative care. Palliative care is a wonderful program that if you can get on it, you should get on it, because those doctors will be able to talk to you about end of life. But generally speaking, if you're still doing treatment, you're not quite there yet, but you would see a lot of weight loss. You would see someone sleeping a whole heck of a lot of symptoms. So a lot of like usually they have ascites, meaning fluid in the abdomen. That's needing to be more frequently drained. Symptoms would pick up a lot. They'd be in and out of the hospital a lot. You would notice those things. And you can watch all of my YouTube videos. I have a million videos about what end stage liver disease looks like. Yeah, yeah, yeah. Bear with me here. I see someone just gifted me $10. I'm going to see it 1 second. Aaron, I'm glad you're here. I'm sorry about your friend. I have not seen orbs, Mr. Pogo, but people talk about it all the time. Has there ever been a death that seemed dark, not so peaceful? Not anything that seemed dark. Definitely have had not so peaceful deaths, but it never felt like dark. No. Thank you, Samson Bates. Yes, almost everyone who dies, their mouth will be open because it takes a lot of muscles to keep that mouth shut. So they're usually just very, very relaxed. Do you think it's voodoo to cut a deceased loved one's hair? No, I don't think so. Oh, rig rentals, thank you. If anything, like, if anyone sees stuff that's like evil or scaring them, I do not associate that with visioning or anything like evil. I think it's probably just terminal agitation and maybe reflects more of like their beliefs or their fears. I don't believe really in people seeing evil things or people going to hell. That's just me. And I haven't really witnessed that. Julie, can you tell me when I'm going to die? Lighthouse, unfortunately, no. Fortunately, unfortunately, I don't know. Oh, Jeff gave me $10. Thank you. I just saw this. Thank you. Payment for your expertise. I don't believe in free advice. Oh my gosh, Jeff. Thank you, Jeff. You're so sweet. Is insurance is hospice an insurance thing, or could a state Medicare participant, homeless person, and a okay? So yes, hospice is a federally funded program through Medicare. However, if you are not old enough to be on Medicare yet, or you don't have Medicare, because let's say you are someone experiencing homelessness, or then the hospice company will usually cover it. No one will like make you pay for it, and your insurance company will also cover it. I have never seen a soul leave a body. No. Someone is from Turkey. Welcome. We are worldwide. Hey, Charlotte. Just nice to see you. I didn't get to say hi to you yet. Thank you for always being such a helper in the chat. We have a great community here. A lot of the same people come back here. Charlotte's one of them. Julie's one of them. Megan's one of them. Steph's one of them. Jeff's been here a few times. Is death from pneumonia caused by sepsis? I think sometimes. I don't know about all the time, but yeah, I mean, a lot of times infections that usually kill you are because they turn septic, which means the infection goes into the blood. Hey, Michelle, thank you for helping and answering questions. Kidney failure, painless in the end stage is how my wife died. Kidney failure can be pretty painless, yes, and quick, painless and quick. Um, yeah. Someone just wrote, "Oh, I'm chopped liver," but I don't know why. But it makes me crack me up. My mother-in-law is my mother-in-law is 90 and has lung and brain cancer. The doctors have stopped treatment, but she believes she will get better. Oh, Eric. This is what I say to people who are 90 and they have some kind of advancing cancer like lung and brain. You know what? I hope she does get better. And you know what? If she has that kind of determination, maybe she will. But I will say anyone who's 90 and above is end of life ish. Even if you're the most healthy 90-year-old ever, you are still closer to death than a 25-year-old is. Do you know what I mean? So like because we only can live so long, our human body can only live so long. So if that is the case, and then on top of that, you have a really advanced cancer like lung and brain, which is no joke, and doctors are saying there's no more treatment for you, then it's like, okay, how do you want to live out the rest of your life? Even if there is a miracle and those cancers are cured, hallelujah, I love it. Still, how do you want to live out the rest of your life? How do you want to live out the rest of your life? And let's focus on that because everyone's going to have an end of life journey, whether you want it or not. All right. And the more you can get to a place of acceptance, the better you will live and the more peacefully you will die. So, Eric, keep us posted about this mother-in-law of yours, okay? Oh, thank you, Island. Island just sent me a $10 saying, thank you for your wisdom and compassion, Julie. Thank you. Jim, thank you so much too. Jason says, I've been on here a few times. It's okay. You can't remember everyone. Jason, I feel like I remember you because I remember your last name, which I can't say. Oh, Sally. Yes, my girl Sally's here a lot also. How long do respite people stay and are they paid? To do respite, you get 5 days. 5 days. And the staff is paid. Yeah. I mean, you usually go into a skilled nursing facility. So it's paid. Yeah. Vicky, I'm hoping we can maybe put my mom on hospice. I'm trying to get home health because it's hard. It is so hard, Vicky Bush. There is no way around it. You are not doing something wrong. It is just that hard. Oh, thank you, Bridget. Laughter is the best medicine. I've also heard dancing helps depression. So now whenever I'm like shopping or doing anything or waiting in line, I try to like dance a little bit. Not that I have depression, but I am like I run a little anxious and I just feel like it's a little more freeing to kind of just move your body. 60 days from this Saturday, I will be turning 54. Mark, that's amazing. You're a young man. You're a young man, baby. I'm like doing a lot of this stuff because like my nieces are coming into town and I feel like they kind of talk like that. They're very Gen Z. They're like period. Do you know what I mean? Like my nieces are like that generation. It's pretty funny. Jan says, Julie, is Dignity Memorial one of your sponsors? I get their ads nonstop now. Oh my God. No, they're not. I'm getting none of that money. But seriously, they're not. I don't know. That's weird. I bet YouTube is just sort of putting ads that would like pertain to things like that. I have no idea. I have no idea. Rosemary says, you look tired today. I hope you're okay. I am very much okay and I'm not tired. Do you know why I look like that, Rosemary? Because I'm not wearing makeup. And I'm not just being mean to myself. That's the truth. Whenever I wear makeup, Everyone here says, "You look so great. You look so rested. You look so good." And then whenever I don't wear makeup, I get a lot of like, "Are you okay? You look sick." And it's because I'm not wearing makeup and because I have a sty. I'm not wearing makeup and I have sty. And I think that's why, a lot I don't get recognized a lot in real life. I do sometimes. And actually someone recognized me from YouTube the other day. I think because one, I'm not really famous to get recognized, but two, I think I look a lot different. Like in real life, like I don't get dolled up. My hair's in a ponytail. I don't put makeup on. And people are like, Julie who? I've actually had some people tell me in real life, like, wow, you look a lot different. I'm like, I don't know what to think about that. Thank you, Eric. What's the difference between hospice and palliative care? Aaron, only because that is a very long winded answer. I have a video on my YouTube channel that says like difference between hospice and palliative care. I would go watch that after this. Go watch it and it'll explain everything. Thank you, Mark. If the doc and family knows they should put their loved one on hospice and the patient refuses, what do we do? If they are alert and oriented and can make their own choice, we have to listen to them. Now, if they can't, because they're not alert and oriented, then you can make whoever is the medical power of attorney can make that decision. Now, also, ask the doctor to talk with the social worker or talk with the hospice company to come in and talk to the person about what are their fears? Why don't they want this? What are their misconceptions about hospice, right? Many people are just like, hospice means you're dying, and I'm not dying, right? Well, then of course they don't want to go on hospice if that's what they think, right? So sometimes it's a matter of education too. So if you can get that doctor to find a social worker or have this person listen to my channel, read my book if they want to, right? Because sometimes it's just a matter of talking about it. And that's what I always start out whenever I have to talk to somebody about like hospice or what they want. I always say, listen, you guys heard me say it over and over again. Everyone has an end of life journey. Everyone. Some people are going to know when they're going to die. Some people are not, right? Some people are going to get hit by a car and that's that. Some people are going to have a stroke and that's that. Some people are going to get a disease and that disease will likely be the thing that ends their life eventually. Okay. So in your end of life journey, you have this disease that a doctor is saying to you, there's no more we can do. Or if we keep doing more, it's actually going to make you sicker, make you worse. Now that you know that, what do you want for your life? And most people will say, I just don't want to suffer. Perfect. That is what hospice is for. Hospice is not about dying. Hospice is about living. Hospice is about living and about living out the rest of your life, helping you do that, providing support for you, support for your family. And you could always say to your loved one too, "Hey, don't do it for you then. Do it for us. Do it for us so we can have the support." But yeah. Oh, Julie Teacher. Here's a little extra cash to enjoy your nieces. Julie Teacher, thank you so much. Oh my gosh. That you are so sweet, my dear. You are so sweet. Hi, Julie. Newish is sub. Binging your videos have provided me with a great deal of comfort. Both my parents passed in 2019. I wish I had known you then. Oh, I get that a lot. I'm so glad you're here now though. And welcome to this community. This is a great community. This is a great community. Thank you, Jerry. I love that name, Jerry. Thank you, Aaron. Sorry, I'm just looking through the chat. Don't mind me. And like, you guys are so great. I love it. I love your videos. Thank you, your shadow. Do you believe in God and Jesus? I believe in God and Jesus. Yes, I love me some Jesus. And I have been a part of, a Christian church like most of my life. I had my own profound experience with Jesus. I will say though, the closer I got to my relationship with Jesus, the less and less I could really be. I felt convicted that I couldn't be a part of most Christian churches because their views to me were just so narrow about the love of God and the love of Jesus. And I don't, the more I, the more I, and this is just my belief, right? So I would never push this on anybody. So please don't push your views on me either. But I say this with detail because most people hear what I have to say and they go read the Bible. I've read the Bible many times, many versions of the Bible. I've studied the Bible, and I have and had a very close relationship with Jesus. And the more I did that, the less and less I could really be involved in the Christian church. And I do not believe that you have to believe in Jesus to go to heaven. I don't believe Jesus would ever do that. I don't believe Jesus thinks you have to be saved by Jesus to go to heaven. I don't believe any of that. And that is through my investigation of Jesus and my relationship with Jesus. Now, I know many Christians will not like hearing me say that. And I do not want to get into a place where I argue in my comments about like whether that's real or not. It's real to me, and that's all that matters because this is my faith. And whatever is real to you is what's real to you. So yeah. But yeah, I don't believe in hell. I don't believe people who don't believe in Jesus are going to hell. Hence why it's really hard for me to be involved in Christian churches. Not all Christian churches are like that, by the way. There are many Episcopalian churches that aren't like that. I also believe that like being gay is okay, and I support gay and trans people and all the things that unfortunately, a lot of Christians don't. Makes me really sad. Do you have any information on cirrhosis with tips and shunts procedure? Benjamin, I don't go into the tips and shunt procedure. I would recommend anyone doing that if they can and need to for cirrhosis. But I do go into end stage liver disease and end stage cirrhosis on my page. You can go look at my channel. How does COVID affect the hospice journey? It definitely can. During the height of COVID, people were definitely dying of COVID. They were on hospice for other things and then they got COVID and then they died. We've had whole families that we were taking care of. The patient, the patient's caregiver, the daughters, and they all died of COVID. It was horrific. So it can affect people and it can kill you, at least the strands when it first came out. It's really, really sad. How do you tell your 5-year-old about death of her grandfather? I would speak to them like a 5-year-old, but also in very concrete terms. I would not say something like grandpa went to sleep or grandpa flew into the sky. I would talk about, there are many books that you can get to talk about grief and death with children. I am not a child specialist and I don't really even do children's hospice. So it's like really hard for me to know like I want to like say it the right. I want to make sure it's like really done the right way. So I would actually investigate and talk to those people or check them out on Instagram or Google it. But generally speaking, you want to speak in very concrete terms. And I think it's very important we start educating about death and dying at an early age, not to scare, but to just understand that it's a part of life. Thank you, Michelle, for the $20. She says, one of the biggest voids I found was the need for extra medical help at home. I needed more help with daily care, but neither private, Medicare, or VA covers this. We felt stuck and I ended up with a slipped disc. Oh, this is the worst part of everything. I couldn't agree with you more. So hospice does not provide the biggest thing that families need, which is daily care. They need help with the daily care. They need help changing their loved one. They need help understanding the medications to give. Keeping them clean, all the things. Full-time job that they can't necessarily do, specifically if they're working, or let's say they take off work to do it. They can't physically do it alone. If someone's 250 pounds, they can't move them and change them alone. But guess what? Medicare and the insurance companies say, yes, you can. Which is ridiculous, but hospice companies are not being mean or wrong. Hospice companies are doing what they are allowed to do, and they are not allowed or supposed to be providing daily care for things like changing and like ADLs, basically. So family has to pay out of pocket for it. Who can afford out of pocket home health assistance? Rich people. That's it. Period. I mean, I made a video that's pretty controversial where I say, you have to be rich to die well. And that's a I say that, it's a catchy thing to get people to watch the video, right? So it's not fully true, but if you really need a lot of help because of physical ailments or like the weight of the patient or whatever, you're working, you have to have a lot of money to be able to pay for someone to come in because insurance companies don't provide it. Long-term care insurance doesn't provide it. Like you said, VA doesn't cover stuff like that. So it's a really tough predicament and I don't have an answer for it. And it's awful. It's awful. Thank you for the $20, Michelle. You're so sweet. And I'm sorry I don't have a better answer for you. Thank you, KTM. Carol is here. She says, I have stage 4 metastatic cancer and watching you has helped me so much. Oh, I have purchased your book and journal. Carol, nothing makes me freaking happier. Thank you so much for being here. So much for being here. And I think being here and being able to say, like, I have stage 4 cancer, I purchased your book, I'm watching your videos, it just makes you a step ahead of most people because most people aren't willing to do that. So I'm so glad you're here. Jennifer, hi. Um, Sarah JD. Exactly. Um, I'm so happy you're educating us. How do you do this every day? What do you do to recharge yourself? You're awesome. Thank you. So I'm actually not a hospice nurse every day. And even before I was like hospice nurse Julie, I worked per diem and I still worked per diem mostly full time, meaning like I was mostly a full time hospice nurse. But I purposely, I don't put money above all things. And I luckily, like I don't have a house, I don't have a house. I rent first off. I like live below my means. So I didn't have to like work my life away because I really value my time and work life balance. So even before this whole hospice nurse Julie thing, I loved what I did, but I think I loved what I did because I didn't work full time. So that's one. And now that I have this hospice nurse Julie thing, I do that a lot. And then I work like once a week, a few days a month. And sometimes I work a lot, sometimes I work a little, just depends. So I have a good, really, really, really good work life balance. I'm also really involved in my sobriety. I work a really good 12-step program. It's a big, big, big part of my life, and it helps me stay centered and loving and, um, yeah, centered and loving and like other focused while still staying grounded and connected to my higher power. Yeah. Do hospice patients often reach a plateau stage where they basically stay generally the same general condition for 1 or 2 months after starting hospice care? Richard. That is if someone has a chronic life limiting illness. So when someone comes on hospice with like an end stage cancer, the decline is usually like steep, like a slope. Why does this look? There we go. But when someone comes on for like Parkinson's, COPD, congestive heart failure, Alzheimer's disease, it's going to look a little bit more like a stairway. Like they're going to be here and then go down a little bit here, go down a little bit here, go down. So it'll be this like kind of like a staircase. So yes, but not all diseases are like that. Welcome everybody. Come on in. I'm just looking through the chat to see if just to answer more questions. Let's see here. Um yes, I have friends in Baltimore and I lived in Baltimore for a few years and I loved it. And I go back to see my friends about once a year, once or twice a year. Before my dad went to hospice, he had a nurse named Moses that watched over him. I wanted to thank Moses for watching over my dad. They said that no one worked there by that name. Whoa. Like, the silence is deafening. I'm sorry, you guys. I'm just, like, looking through, I feel like I've, like, missed a lot of questions, so I'm, like, really trying to look through here. Hi, Anna. Thank you so much. You're the best. Thank you for all you do. She's a hospice nurse. Okay, MS says, "Hi, Julie. My 85-year-old dad was recently diagnosed with early onset Parkinson's. I know progression is different for everybody, but I'm afraid he's in denial. What do we say to him?" I would take it if he was just diagnosed. You said recently, right? I would take it, a week at a time. And Parkinson's can be the slow progression, depending on age, depending on comorbidities, depending on different things, right? So if he hasn't been someone to be really forthright about his feelings and really able to talk about how he feels and talk about things, he's not going to suddenly be able to do that just because he was newly diagnosed with something. So I would give it some time. I would give it some time. Just keep checking in on him whenever you think of it. Don't hyper focus on it, but like, how are you? Anything new? And then when time comes where you feel like, wow, we really need to start talking about this, like he is going downhill and like we need to get things in place. I mean, obviously, I guess do it before it feels like urgent, right? I would word it like, and maybe you could do this now. I would word it like, Dad, I know you don't really want to talk about this right now. I know it's probably hard to talk about it, but you will be helping me if you can let me know what you would like by you helping me know what you want when you are sick, because I know you're not sick right now, but eventually you may start feeling sick, you may start declining, and it would help me to know now what to plan for, how to help you when that starts happening. That will really help me. And usually, when you start wording it around yourself, like, I know you're okay. I know you don't need this, but it would really help me if you could tell me so I can feel better. And most parents just want their kids to be okay. So it can help him kind of start opening up. Okay, well, I'll talk about it because not because I want to, but because it'll help you. So that's one thing you can do. Let's see here. Question: the three P's. Are there any tricks to making number two less smelly? Not that I know of, honestly. I'm sure there's dietary stuff you could do to make your bowels less smelly, but that's not something we really focus on. We're like, oh well, they're smelly. Oh well. Do you know what I mean? So, oh, I'm sorry I don't help you more. Julie, is it common that people die when someone leaves a room, even if it's only for a few minutes? It can be a common thing. It usually is based around their personality. If someone's like really independent, really private, a lot of times they will die alone. You're in LA. Have you ever had to care for a celebrity? Not that I could really tell you, but there have been some people, yes, that were quote unquote famous. Now, a lot of times you have to remember that, like, a lot of the people that I took care of that were like famous were people that were famous before my time or famous in a area that I'm not really familiar with, right? Like I don't know like famous directors or famous music producers, things like that. So it's like along those areas. Like so yes. Yes, yeah. And because I work in LA, there's a lot of like famous people. There's a lot of Scientologists, which is always interesting. There's a lot of different ethnicities. There's a lot of different religions. There's super, super, super 1% wealthy people. And then there's like the poorest of poor, skid row under a bridge. So it's pretty wild. What type of agency can help with daily assistance? A home health agency, but you have to pay for it out of pocket, which is why it sucks. Don't get me started. Why insurance in America is horrific because you shouldn't have to pay for home health assistance at the end of life, and most people can't afford it. Ugh. I'm not mad at you. I'm mad at the system. Difference between comfort care and hospice. Basically, comfort care is usually happening. Rita, I'm not sure if you're in America, so I feel like a lot of people who are not American, they call it comfort care. Comfort care sometimes happens in the hospital because they can't get hospice in quick enough, or they can't get the person to um, get into their home to be on hospice. So they call it comfort care. But I would say they're both end of life care. Thanks, MS. I'm glad you're here. Queen Bee started yesterday. Hospice called today. It started. Everything is rolling in already, and it's overwhelming. What should I expect the next week or so? It will calm down, Queen Bee, for sure. It'll calm down. And I feel like the best thing you can do is kind of curb your expectations on like how they're going to help you, what they're going to provide. Because I was just talking about how like they don't provide daily care, right? And that's not the hospice's fault. That's our insurance and Medicare's fault. But what we can provide is like it's going to be a little crazy first couple weeks getting things set up, getting the supplies ordered, a bunch of people calling you, right? And then it's going to be kind of quiet, especially if like there's not a lot of issues going on. So, just try to take it all in stride. Call when you need to call and ask questions when you need to ask questions, and try to stay in today. Stay in today. It will definitely settle down. I swear I hear someone like screaming outside my window. I don't know why. Question: my stepdad suffers from severe alcoholism. Lately, he's been falling a lot. Oof, very fatigued, lethargic. He's a sweet man. I want him to be comfortable. How do we know if it's the end? He'll be. It's really tough. I mean, he'll start turning yellow. So I don't know if he's yellow yet. Starts turning yellow. If the white of his eyes are yellow, his skin has a yellow tint. If his stomach pops goes out like this, could have end stage ascites. If he goes into the hospital for whenever, like they'll be able to tell you if he's end stage. He'll bruise a lot. Yeah, it's really, really sad. I'm sorry. Hi, Julie. What happens when spirit leaves the body? My husband will die at home. What should I expect? So, Trisha, I don't ever look at it like that because I do believe in like the soul and our spirit and stuff. But generally speaking, I'm speaking about like what would physically happen. So, when someone dies, nothing happens, right? They look peaceful. They don't always look like themselves. Their eyes might be open, their mouth might be open. You'll call hospice. Hospice will come over. They'll call the mortuary. Your person will kind of stiffen up a little bit. So once they die, they will look a little different. If you want to know like what to expect the full progression, I would watch a lot of my videos. I talk about like what to expect at 6 months, 3 months, 1 month, actively dying phase. And then I do have a video about like what to expect after someone dies. But the body looks, I mean, it sounds so like obvious what I'm about to say, and it doesn't sound like I'm being helpful, but the body, they look dead. They look like your person, but like not your person, right? Because it's just the body is there. The consciousness is gone. But I have many videos about this, Trisha. So please go check those out. And I hope they will be helpful. They're all labeled, so they should be good. Ascites, yeah, it can versus visceral fat. How do you know which is which? You have to go to a doctor. You have to go to a doctor. Many people have many gentlemen have those big bellies, right? And it's not ascites. Ascites will kind of happen like boom, like all of a sudden it's just like boom, you got fluid. So if you develop this fluid within like a week, that's not visceral fat. That's ascites. You usually start having other issues before then too, turning yellow. Your sclera of your eyes are yellow. You might have some confusion. Um, so yeah, you'd have to go talk to somebody. Or like and like a lot of times people have to go see a doctor before they know. But a lot of times the ascites happens kind of quick and you kind of already know something's going on. Like you already know you're having issues usually. I have never seen someone come back to life on hospice. No. I do have a cool story about a lady who was very close to death and she came back to life for 3 months. I tell that story all the time. That will be in my videos. Okay, listen, you guys. We have 5 minutes and I need to stop before, don't get off yet. Listen. So today's my last live of the summer. I'm not going to do a live in August. Okay. I'm taking off the month of August. I'm still doing my videos, just not lives because I want to take a break to come back for the fall. Okay. When I come back in the fall, I'm going to take the month of August and kind of think about how I want to do the lives, what day I want to do them, what time I want to do them. If I want to do a call in show, like I'm going to take the month to kind of figure it out. Okay, so be on the lookout. Make sure you subscribe to my channel. It's free because if you subscribe, then you get like updates on like what's happening. You also can go to hospicenursejulie.com and scroll down my page and it'll say like sign up for my newsletter. I will not bombard you with newsletter stuff. I swear to God on everything holy. It'll be once a month. And there I'll be able to tell you like, hey, come this fall, I'm gonna start a new whatever. I might just go back to the lives, but I was thinking, I know, Jerry, I was thinking about a call-in show, maybe putting some money into it to make it a little more like accessible for people to call in. And I don't know, we'll see. So I'm taking the month off just to take the month off. And so I can kind of think about how I want to come back in the fall. Okay, so pass the word. I won't be here in the month of August. But I love you guys, and you can get me and you can find me on Instagram, find me on Facebook, YouTube, TikTok if you want. My book, Nothing to Fear, is out now, and the journal is out. So a lot of ways you can get education out there. Um, and thank you for all your support. And I hope you guys enjoy your August. Okay. I hope you enjoy your August, and I will see you in the fall. All right. Love ya. Bye.